Welcome and thank you for joining us here today. My name is Dr. Mary Newton, and I've been in the healthcare profession for roughly 18 years working with adults and children with brain injuries. Today I have the privilege to volunteer with the Brain Injury Association of Michigan to help bring awareness of brain injury, its impact on the individual, and also the impact it has on the family and the community in which the individual lives in. This is an important topic because brain injury is one of the most underfunded and misunderstood ailments a person can have. Joining me here today to talk about this topic are Ann Getty, who is a brain injury survivor of 2.5 years. Welcome. We also have Susan Peak, who's a caregiver to her brother who sustained a traumatic brain injury in 1996.
Yes.
And we also have Mr. Tim Kowalczyk, who's a recreation therapist, and he's currently working for a company called Home and Community-Based Recreation Therapy Services. Welcome to all of you.
Thank you.
Before we get started with our panel, I'd like to show a very touching video of some remarkable individuals who have not just survived brain injury, but have thrived in spite of it. In this video, there's also an important message about a very unique type of insurance that we have here in Michigan called Michigan Auto No Fault Personal Injury Protection. It's because of this insurance, which no other state in the nation has, that we are able to have top-notch services in this state, along with the best facilities and research that we can find for brain injury. So we're very lucky to have that type of insurance here in our state. Let's watch the video.
Let's get this party started.
Is it on straight? Is it on straight? She ran out of glue last week. It almost blew off.
There are certain people who seem to appreciate every breath more than most. People who overflow with gratitude for life.
It's wonderful. It's wonderful.
Because they came so close to losing it.
Because I am. Oh, I'm gonna cry. Just because I have such a loving family, so many friends.
All of my doubt.
My name is Scott Graham Dingwall, and I'm 27 years old.
My cousin Scott was in an accident when we were 3 years old. He was hit by a drunk driver.
We were hit by two young men who had been drinking and celebrating, and they were instantly killed. And Scott received a life-changing spinal cord injury.
He sustained a brain injury. He sustained a spinal cord injury at C6 with no movement from his arms down at that point, and he was also unable to breathe on his own.
It happens in an instant. It changes your life totally.
But it impacts everyone who's involved in their lives.
Scott is one of the estimated 200,000 people in Michigan living with a brain injury.
I had a serious carbon monoxide exposure at our cabin in northern Michigan.
I came in and found him and called 911.
I don't remember the next 3 months.
Jim's situation was very catastrophic.
The Petoskey ER room figured out that he had CO poisoning. The advice from the doctors at Spectrum was that we should take him home and put him on hospice care, which we did.
When someone's family is being told, to contact hospice, that's as grim as it gets.
You had to see him. He was on a ventilator. His eyes were both moving in different directions. He had no quality of life, and so we certainly didn't want to extend that.
The first time that I looked at Jim, I recognized how significantly impaired he was, but I also saw that there had been evidence of progress, and I really did feel that we could build on that.
It was funny. I didn't want the children to have false hope, so I didn't tell them that he opened his eyes for me. But he had opened his eyes first for our son, and he didn't tell us. And then he opened them for our daughter, and she didn't tell us.
Fortunately, she contacted the Brain Injury Association.
She said, there's just a quiet team that is there for you if you need us.
That quiet team is the Brain Injury Association of Michigan, a network of care providers ensuring patients like Scott or Jim get the services and support they'll need.
How many reps?
But it isn't just for the patients, it's for the families as well.
The Brain Injury Association is a wonderful organization in helping people for resources, for support.
People have great opportunities and great potential if we can get them the resources they need, the equipment they need, the support they need.
I will support them in every way that I can.
These are people who know being in Michigan made the difference.
My son was injured on Crooked Lake up north near Petoskey in a jet ski accident. He was T-boned and was in a coma for 3 days. And I can tell you that drive up was the drive from hell. I knew one phone number on I-75, and that was 1-810-229-5880, and it was the Brain Injury Association of Michigan. 4 years later, he is a freshman at Michigan State University in the Lyman Briggs College, struggling like hell, as any college freshman does. And I owe that to what was available here in Michigan.
Michigan is a very special place. To be in a state where you know if something happens, you have a support team that is not just your friends and family, it's a system that's been built to take care of you for the rest of your life. That's something that's very valuable. I don't think you can put a price on it.
We have the resources in our emergency rooms, and we have the resources in our hospitals to help people with catastrophic injuries and not put our hands up and say we don't know what to do, because in Michigan we do know what to do.
But it's more than just our Michigan hospitals and doctors.
No Fault has given Scott the medical equipment and services that he's needed for, 25 years now. And if we had not had those, my husband and I could not have afforded to take care of all of his needs.
Without No Fault, his family would be obviously bankrupt trying to pay for all those things.
Through the Brain Injury Association of Michigan, these patients found the care and support they needed.
You've got to be as aggressive as you can in that early care to get as much of the brain function back. Dr. Perlman was very good at that.
Dr. Perlman's fantastic, absolutely fantastic. Gave me a second chance. I wouldn't be here today without him.
When I come downstairs every morning and I say, Scott, how are you? And he says, I'm awesome. How could you not be anything else but awesome also?
He can be hooked to 10 IVs and tell everyone he's having an amazing day.
Just his smile. Gosh, he can just rock the world with that smile. And anyone who meets him remembers him forever.
The only time I'm not really happy with my life is during the winter, but I think we all feel that.
What touched me the most about Jim was that he was so motivated, and we were able to provide him the resources and expertise to enable him to achieve his dreams and goals.
I learned how to walk and I learned how to drive. I'm back at work. In addition to driving, I downhill ski in Vail, Colorado 2 weeks ago with the twins.
When people have opportunities and the right resources available to them, it's amazing what the human body and the brain can do. Makes me feel great, because that's what I'm here to do.
I have loved you for 1,000 years. I love you for 1,000 more.
That is a very powerful video. Every time I watch it, I get very touched. And as we're watching the video, I can't help noticing that you have some tears in your eyes. Being a brain injury survivor yourself, I'm sure you can relate to the experiences and the feelings that some of the people were talking about in the video.
Yeah.
So let's talk about your situation a little bit. And about 2.5 years ago is when your injury occurred. And you're not a stranger to the mental health field. Like I said, you've been a mental health therapist for 30 years at the time of your injury. And you were used to working with different kinds of populations, and at the time of your injury, you were working in prison with inmates was the population, and you were doing some group therapy. So let's talk about the day that your injury occurred.
It was a day like any other day. We were in the process of starting a group. One of the group members pushed me on the shoulder, and I fell down, hit my head, and then she began to kick me in the head and back, sides.
So she assaulted you?
Yes, it was an assault.
And what happened during after the assault, during the assault?
Well, they brought in some nurses, because they're nurses at the facility, said, how are we doing? And eventually I was taken to the hospital. They did an initial check for bruises, contusions, and breaks. And then I was sent home, and I followed up with some physical therapy at a clinic.
Which they said to do for
Yes.
some of your bruises.
Yes.
And if I'm not mistaken, you attempted to go back to work very
Yes.
shortly after the incident. And what happened there?
Yeah, I was ordered back to work by one of the early treating physicians, and it was difficult. After the bruises and contusions were gone, the primary affecting conditions were related to inner ear and eye movement. So I had a difficult time maintaining balance, and have been in physical therapy, I guess, 5 times now for that. So it was really difficult, especially in a secure environment, to work if you can't adequately place your environment and yourself in it. So just moving.
And seeing your environment, of course, all the way around you.
Yes. And
It's not uncommon for individuals who have been kicked in the head or assaulted or have some type of brain injury to have what you're describing, which is known as vestibular injury. And so the inside of the ear canal and your eyes were not focusing anymore, and it was making it very hard for you to find your feet in space and not be dizzy when you walked and moved around, and big movements up and down.
read computer work, because if your head's moving
Right.
like this, as you're going through your day, or you're working on a computer and you have to turn, all of those kind of movements would bring on symptoms.
So what you might be wondering by now is that I haven't used the word brain injury with Ann yet, and yet I said that she's a brain injury survivor. It took quite a bit of time, because not only is brain injury misunderstood and underdiagnosed, or misunderstood by the general population, but it's also very underdiagnosed by certain medical professions that may not understand what they're looking at when they are looking at a person in the ER with contusions and bruises. So about how long into your recovery did you get actually diagnosed with your brain injury?
Probably 6 months or so.
So 6 months went by and no diagnosis yet.
There was a
for
diagnosis,
brain
there was no
injury.
treatment. So someone diagnosed, not the brain injury, but the precipitating, all of the symptoms were
Brain injury got
diagnosed.
diagnosed at 6 months along, and then some treatment followed that finally. They included some neurorehabilitation and cognitive treatment and vocational. Was there any
Some of it-
vocational?
There hasn't been any vocational. One of the things that happened as a result of this is I was retired, so.
So that was the impact of your brain injury, even though
Yes.
by medical terms Anne suffered what's known as a mild brain injury. The impacts of even a mild brain injury in the individual can be profound, and it can be lifelong. Anne retired medically from work because she was unable to perform her duties after the brain injury. And socially, I know you try to get out sometimes and do some normal things that you used to do before your injury, but some of those things have become harder too based on the dizziness. Recently, you tried to attend an event to watch Hamlet.
And we did go. We did go to see Hamlet, which I was really happy to do. I was so excited. But getting up and down the stairs was a trick. So I had a friend. Had the chair on one side and a friend on the other side. So I held on to the chairs, and I held on to my friend, and we went down the aisle that way.
And so this is something you and I might take for granted, being able to go up and down the stairs to see a theater event. But to somebody like Anne, post-injury, this might be one of the biggest anxiety-provoking situations for her for a very long time. And we're glad you're able to do that and work toward recovering as much as possible. Thank you for sharing your story with us today. Now,
Thank you for having me here.
You're very welcome. Today we're going to move now to the next person on our panel who's not a brain injury survivor, but whose brother is. And he was injured in 1996. And since that time, she has been his primary and sometimes sole caregiver.
Yes.
And she's going to talk to us a little bit about her brother's injury first, and then her experiences as a caregiver to her brother post-injury. Sue, thank you for joining. Susan, thank you for joining
so
us.
much
Please
for having
tell
me.
us your story.
My brother was, he lived in Ohio at the time, and he was in a car accident, hit by a drunk driver. It was catastrophic from the beginning. He arrested at the scene. He had to be resuscitated at the scene. He was in a coma for a good length of time, and when he started to come out of the coma, he was like a newborn. It was like we had to start all over, like a newborn. And I think about a couple years after the initial accident is when it got too overwhelming for my mother. She was getting older and she just didn't understand the intricacies of a brain injured person. And so that's when I went and got my brother and brought him home with me. That experience in bringing him home with me was something that I could not have written about. You cannot foretell what that's going to be like. And when he first came with me, if you got 6 words a month, you were doing great. He was incontinent. He was having cluster grand mal seizures. We were calling the ambulance 3 and 4 times a week in an emergency room. And that happened like the first 2 or 3 years. I was blessed to have a husband. We decided I had to come out of the workforce. Even though I had a great job, it cost more to have someone come in because of his condition than I made per day. So I came out of the workforce to care for my brother. And
let's talk about that for a few minutes.
Yes.
As a caregiver to your brother, you made a decision at some point that this was going to be something you do long term.
Yes.
And like many caregivers out there for individuals with traumatic brain injury, it becomes your life. Yes. And obviously you made the decision to quit your job, so this is your full-time work, is to be a caregiver to your brother.
Yes.
You mentioned that it costs more to have somebody come in than what you made on a daily basis. So I'm assuming that means you would have to have paid for it out of pocket. Tell me more about that. Your brother has funding through Michigan Medicaid.
Correct.
Which is different than workers' comp or auto no fault or some even private insurances. And through Medicaid, I'm not so sure that all the same fundings are there, and obviously not that what you needed for your brother's care. Tell me more about Michigan Medicaid and how you struggled to get services from them for your brother.
It was quite emotionally draining on the phone every day, calling someone, trying to figure this maze out because they send you through such loopholes only to find out, well, no, we don't provide that kind of service. So in finding out what they did offer, they gave me an option of incontinent garments, or to have someone come in a couple of hours a day to help, which did not fit for me because you had to tack in on the end of a person's schedule that they had developed for themselves. I didn't necessarily need someone at 3 or 4 o'clock in the afternoon. It was conducive for me to have someone in the morning to help me get him ready for the day. Respite, it was very saddening to find the facilities that were offered for respite through Medicaid. I visited over 100, and I've done pop-up visits. That I love to do that. I don't like to schedule visits. And the places were horrendous. I would not recommend to anyone. And I have to look at, my husband and I, we would love to have respite. We would love to have some time alone. I have to think now, because my own health is declining in a lot of ways, what would happen to my brother if something happened to me. So I would like to think that there would be a residential facility out there where I would feel comfortable that my brother could be. Unfortunately, I have not found such a place, and it's so disheartening because with the Michigan no-fault insurance, there are fabulous places. There are places here in Michigan that if you had a loved one who had brain injury, there would be hands down. You would entrust their whole life with these facilities. And it was disheartening to go from each one and they tell you, oh, we could do wonders for your brother. Your brother would fit in. But when they found out he had Medicaid, it's like, we have these things, but just not for you. And it was very disheartening to get that time after time after time again, because your life becomes so overwhelmed and so all consumed in everything about your loved one. Everything.
And your story as a caregiver is a very common one for individuals who don't have the proper funding. Burnout is high for caregivers. No respite time, becoming in your entire life. And then just the frustration of paperwork and red tape and trying to get services that you know would help your brother if he had them, and not being able to find the funding for them. How frustrating is that? I'm sure it's very frustrating for you. Thank you for sharing your story. We'd like to talk to Tim. Tim, this is a good leeway right into your profession. You are a recreation therapist by trade, and a lot of people out there don't even know what recreation therapy is or what a recreational therapist does, especially for individuals with brain injury. So why don't you tell us a little bit about what it is that you do?
Thank you, Dr. Newton, for having me. Recreation therapy is all about, like the video showed, helping individuals try to find the awesome. Helping people who have suffered an injury get back out there and balance the work and play. Putting the fun back in functional is like what we like to say. So
it's a good way of putting it.
Yeah.
So individuals like Susan's brother, would they be able, given their funding, to benefit from recreation therapy?
Well, I'm a firm believer that everybody could benefit from recreation therapy.
Yes.
Unfortunately, it's not always funded. Recreation therapists are out there in many places, traditional hospitals, inpatient mental health hospitals, skilled nursing centers, even schools, adaptive sports, community rec. So there are services out there that can benefit many people. Unfortunately, sometimes it's not funded by private insurances. Michigan Auto No Fault is a great provider, and one of few in the great state of Michigan that does.
So even if your services could benefit and would benefit her brother, due to Michigan Medicaid not funding it, is not something that is available to her and her brother.
Right, at this time, yeah. It's an ongoing process to continue finding ways to be able to provide those services to everybody. Which
are important. One of the things that recreation therapy does, as Tim will talk more about, is provide quality of life or improve quality of life. We have all in this field have heard our patients at one point or another say they feel very isolated. They have no more friends. Family members have walked away. And they want to be out there. And as human beings, we all want to belong to a group and do something that's social and be around other people. And after brain injury, a lot of times that goes south. So how does recreation therapy fit in with providing them community resources and not being so isolated?
Absolutely. Brain injury is a lifelong, life-altering, significant injury, different than a broken leg. And recreation therapy complements your more traditional therapies and rehab of physical therapy and occupational therapy by maybe being in the shadows even a little bit more, helping an individual find a community, find social outlets, adapting activities that they once participated in before their injury, and modifying those to be able to engage again and find something that gives them that awesome feeling and that community and family again. Providing those opportunities and resources that are out there. They just might need a little extra assistance to overcome some of those social anxieties and sequence certain steps into finding them and putting it all together to bring that whole quality of life back.
You said earlier that everybody can benefit from recreation therapy. So it doesn't matter if they are confined to a wheelchair, if they are bedbound, if they are as profoundly impaired as Susan's brother cognitively is, or is perhaps not as impaired. Like Susan's a very high-functioning brain injury survivor. How do you do your services to complement each type of injury?
Well, in general, our programs are developed on an individual basis. We assess a client and their needs in their community, their likes, their dislikes, their abilities, their deficits, and we try to formulate a plan to get them back in action, from adaptive water skiing or other sports to simply attending to a task long enough to play a game of cards that they used to really enjoy. And it can be even, finding a cooking class and assisting them in interacting and building some of those social skills and that confidence to achieve that increased self-worth and sense of accomplishment.
Would you say that your service complements mental health therapy services?
Absolutely. Quality of life is big for anybody. Depression and isolation are very common ailments that people suffer from, whether they have an injury or not. And so anytime that you can find, as human beings, we're more likely to engage in something if we enjoy it. So finding a way to enjoy an activity again will only improve quality of life and onward.
Susan, you've heard a lot today from Tim of recreation therapy. Have you heard of recreation therapy before this conference?
Yes.
And in what context?
That was in one of my many daily journeys of phone calls and surfing the net, trying to find something for my brother. And I heard about recreational therapy, and I thought, oh my gosh, my brother would love that. And it would be important. He, could possibly be able to enjoy peerage, someone or people just like he, and have fun making friends, making a new friend. And I thought that would be great, but when they found out Medicaid, it was again another no. We have this great service, just not for you. So
it's very discouraging, I'm sure.
Very.
I couldn't imagine having a loved one in that situation that you're trying to help, and knowing that within a stone's throw away. In Michigan, we say we can't throw a stone without hitting a wonderful facility, a great rehabilitation clinic, fantastic physical medicine doctors, and all types of services like recreation therapy, speech therapy, music therapy, art therapy. It's all available in the state, and how frustrating that it's underfunded through Michigan Medicaid for your brother.
Yes.
Tim, would you have any kind of advice for individuals out there who might be in the same situation as Susan's brother?
Absolutely. Because of Auto No Fault and the advocacy that we have in the state of Michigan, through the Brain Injury Awareness of Michigan, there is a fairly large community for social support and support groups and opportunities to gather and build some networks and share resources out there. So the website will be on the screen a little bit later, and I would encourage everybody to at least visit that and start your journey there for some of that support.
Thank you so much for that, and thank you to all of you. I know that it was very hard for you to watch that video. I watched as you took some Kleenexes to wipe your tears. And thank you for being here, and I know your journey has been very difficult so far, even though you have one of what's considered one of the better fundings out there. It's still been a very long journey because of the lack of diagnosis of brain injury on time and everything that has been a hurdle in your way of recovery. And Susan, thank you again for joining us and talking about your brother and everything that you've endured. We appreciate the knowledge, and our viewers out there might find some good information that they can act on too. And Tim, for all the information on rec therapy. If you don't know what rec therapy is, there's lots of information out there, and perhaps you might want to be a rec therapist yourself one day.
Absolutely.
And to everybody else, thank you for joining us and talking about brain injury today. At the conclusion of this program, there will be information on the screen that you might want to write down if you want more information on brain injury. Perhaps you know somebody has a brain injury, perhaps you're a loved one of a brain injury, or you may have a brain injury yourself. The Brain Injury Association of Michigan is here to advocate for you and give you information. So when nobody else answers the phone, they will, and they'll give you what you need. Thanks so much for joining us today.